Welcome, everybody, to the Strength and Knowledge podcast. I'm very excited today to bring to you somebody who I think is in a very, very innovative and progressive space in terms of how he is incorporating certain things into his practice as a physical therapist based out of San Diego. Please welcome Dr. Justin Ternes.
Hey, man. Thank you for having me. I'm very excited to be on this podcast with you. Dr. Funk, I've been admiring you from afar. I really appreciate all your work. I feel like I've seen a lot of growth in the last 4 months, 8 months with you, just watching and observing how you've shifted and navigated everything. So I'm really excited to be here as well.
Well, I appreciate those sentiments. And to be quite honest, I have become more and more of a fan of what you have going on with regards to social media, right? True self-health for anybody out there who's looking to connect with him. But he is incorporating things like breath work, cold exposure, and I know he's an extremely big advocate of deep emotional health work. And I think these are all things that we talk about, but to see him regularly incorporate them, I think almost make them primary focuses within his cash-based or cash pay home-based PT practice. It's something I wanted to bring him on and talk to him a little bit more about. But Justin, I mean, having conversations with you, you feel like you're in a position where you have found what makes you tick, and you feel like you're in a position in your life and your career where you feel very fulfilled. You're in the driver's seat, but knowing that that doesn't happen for everyone. And the fact that you found that within 4 years of graduating from PT school, can you share a little bit about your journey and really what it's taken for you to get to this point in your life?
Absolutely. Like you said, it hasn't been a easy journey, right? I got out of school. I went to Franklin Pierce University in New Hampshire. I'm from Arkansas originally, so kind of bounced around. But I remember a professor in college said that ideas start on the coast. New thoughts start on the coast. And living in Arkansas, I heard that and I was like, okay, I want to see what's going on the coast. So I hit both of them. And really what I found was this curiosity about how I can improve my own self. I was in San Diego here. There's a lot of Eastern philosophy, medicine, acupuncture, Reiki type stuff, and a lot of yoga. I live in one of the premier yoga cities called Encinitas, California. And so really I've had this deep desire to connect with myself and make myself feel better. Not that I was constantly in pain or in stress or anxiety, but I noticed that I could feel better and I would be more me if I did these things that had a little bit of difficulty. And so I started practicing ice bath. I started practicing Wim Hof breath work for myself. And as I was doing all this work for myself continuously and feeling more charged, like that inner fire in me started to become more vibrant. I noticed that my interactions with patients shifted. My patients care, their focus on themselves to start to and push themselves started to mimic what I was doing for myself. And so I was like, okay, good. I don't have to focus on my patient. I focus on myself to improve my own mindset, my own physical well-being, and that's just going to naturally rub off. And so that's where I've been coming and really doing a lot of the work. And like we were talking before the podcast started, I feel like I'm in the sweet spot, but it's required me to do a lot of conditioning, a lot of shedding of different layers, expectations, like that inner fire that I have. I'm just naturally energetic. I go. I can talk forever. But growing up, that was often highlighted as a negative. ADHD, you're you need to sit down, be quiet. So anytime I expressed myself, it was often met with, no, don't do that. And so where I am now has come, and I love the deep emotional work too. Everything you just said, those are my pillars of my own personal practice, which have now started to translate and bleed into the work I do with patients, which is breath work, cold exposure, stress, and then emotional health.
And I mean, hearing you, I honestly, I mean, that resonates with me. Growing up, I was somebody who had trouble sitting still. It was repetitively on my report card, is unable to sit still and avoid talking to those around them. I would have a great report card, and then I would either get like an N or an S in self control, in behavior in class. And it wasn't for any other reason than like I genuinely just enjoy engaging and connecting with people. I think the hardest time, and I don't know if this is kind of a struggle that you felt, is it took me a while to realize that my extroverted self needed moments of introvertedness to actually sit and like listen to what was going on. How am I feeling at this given moment? Am I actually happy? Is this improving? Is it different? Am I in control of this? Am I giving something too much or too little? So is that something that you kind of had a moment with? I mean, was there ever a point in time maybe where things were really challenging and you started to peel back the layers, or was this something that you've just gradually pushed into throughout throughout your career?
I think it's a combination of both. There's been moments and moments and moments and moments. So it's a gradual layering on of moments. And I love what you said about what am I feeling, what's going on. That's something we frequently do in our men's group. So I work for an organization. I'm partnered with a group called Everyman. It's EVRYMAN. And we have and host peer-to-peer men's support groups for emotional health. So it's opportunities for like 8 guys get it on Zoom, drop in. And our primary teaching is very body-based. We do check-ins to start. Check-ins are, how am I feeling in my body first? So label 3 things, 4 things in body, notice, feel, slow down, breath. And then what am I feeling emotionally or energetically? So this practice of checking in with what I'm feeling right now is very powerful. And it's something that can be used as a tool to slow down, to take in all these data points, which I call emotional awareness, is just collecting the data. Because before we can make an informed decision or actionable change in our behavior, you need to know where you are and how you perform and what you're doing. And so what I heard you say is you were taking in, collecting data on yourself. What's going on? What am I feeling? And I feel like that's what I've been doing for a considerable amount of time, maybe since my like young 20s, when I wasn't feeling so great in college and confused on what I wanted to do. My uncles were doctors, radiologists, oncologists, and my father was a psychiatrist. And so I'm in college and I'm like, med school. Okay, I'm going to go to med school. I didn't want to go to med school, but med school is the path. And so I like sign up and I do all the thing, take the MCAT, go to interview. And I remember I went to an interview. I don't think I've shared this, but I went to an interview and I was so nervous, but they're like, what are your thoughts on euthanasia? And I was like, well, there's a lot of youth in Asia. Asia is like a developing country and there's billions of people. So, I mean, I would say that they need to start to think about promoting. And I just started going in and I completely missed what they were doing. And I felt so embarrassed. And that was another like collecting data point. Like I froze. I was like, I don't even want to go to med. That's like if that's not an indicator or not. Like, so that's one of those moments I was just like, what am I doing? And I ended up getting accepted and I had another interview. And before I took that other interview, I was on the phone with this lady who was taking my interview application and setting me up to schedule me in. And she caught me and paused me and said, "Do you want to do this?" And I was like, "Yeah, I'm on the phone with you. We're doing it." And she's like, "Well, what do you really want to do?" And this, like, it's so funky that I was calling for an interview, that this lady heard something in me, slowed me down, and she's like, "What do you want to do?" And I was like, "You know what? I randomly got placed in this physical therapy internship, but I love it because I'm in front of these patients and I can see problem solving in the moment." And she's like, "Okay, I want you to go to this website, da da da." And from there, I canceled all the rest of my med school interviews and jumped into the physical therapy world, and the rest has been history. So yeah, there's a lot there, but yes.
It's kind of funny, and I won't dive deep down that, but I actually started out as a pre-med major in college as well. So having a different reason why I went into DPT, it was more related to an injury. And then I just fell in love with what happened throughout my rehab process.
Mm-hmm.
But for you, I mean, some of the things that I'm thinking about that I've incorporated, and this is just maybe something for people out there that are listening, but I've gotten to the point where I try not to listen to music first thing in the morning when I go to the gym. Like, I choose to go to the gym every morning, and I just get in the car with my coffee, and it's just me for 15 minutes, and I'm just gathering my day before I go into the gym. The
Mm-hmm.
gym, I know it is not traditional meditation, but I unpack a lot of things when I'm at the gym. There's a lot of things that go through my head during that probably first hour and a half where I'm making coffee, getting in the car with no music, and then just freaking getting after it, So that
Yeah.
especially is a time where I try to wake up a little bit earlier so that I can't have interference. I can't have people texting me in the morning. Nobody's calling me. I'm not worrying about email because this is before 7 a.m. And that really helps me out. And then honestly, at the end of the day, when I'm driving home, I try to do the same thing. And that's kind of what works for me at this point in time. When I was starting Rehab to Perform, I was struggling with self-investment, and I was ignoring myself. I was the person that says, "I'm always busy, I'm busy, I'm busy, I'm busy, I'm busy, I'm busy." And all I was focusing on was company, and I wasn't focusing on self at all. And it
Mm-hmm.
got to a point where I just got depleted. It was about 2 to 3 years in. I was depleted. I was struggling on a personal level because I'd ignored myself for so long. Not necessarily, these aren't endorsements. It's just what I did. But I started with a 5-minute journal and the daily stoic with regards to, the morning readings.
Mm-hmm.
And that was kind of what helped me get to this spot where now I've got the daily stoic right over there. I don't necessarily do the journaling as much, but the way in which I try to process is much like the journal. Here are my 3 wins. Here were 3 challenges. The day is going to be great if I do these things, not if events happen, but if I focus on process. What are some general recommendations that you could make for, say, either the person going through PT school, the young professional, and they're struggling with themselves on a personal level? What are some principles that they can start with?
Well, I love what you just laid out, which are multiple options, and that's what we all have. One of my favorite quotes growing up in like the college sphere was, "Quit as many things as you can until you find something you can't quit." And I love that, and I took that to heart. And I've tried journaling, and I quit journaling because I could quit it. And then I tried breath work, and then I quit breath work. And then I was like, wait, I can't quit this. This is so good. It fits me. It adapts to me. And then so I tried ice bath, and I couldn't quit that. And so those are 2 things that I do regularly. The same thing with other like sitting meditation, 20 minutes still. Tried it, quit it. That doesn't fit me. It's more of me forcing against myself rather than being in an environment. So I think that knowing that there are tons of tools and you're not married to anything is important when trying to find out what works for you. Because then, say you here someone's doing their journaling and they're writing down 3 things that they're grateful for every morning, and you're trying that. And it's like, in ice bath, in stress, in any kind of stress practice, weightlifting, etc., if there is a resistance that's present, or a involuntary forcing of that stressful behavior, you're not going to get the same benefit as that, like bringing yourself into that experience with this positive, grounded optimism of, I'm doing this for me. That's why I love the ice bath. And I'll just promote that first. If you're curious about this cold exposure stuff, at the end of your shower, either crank it full blast and go for it and go cold, and just try to get your whole body for like 20 seconds. Try to keep your breath nice and calm. If that's too intense, you can just go half cold, right? Again, the goal is to get enough cold shift in your shower at the end to maintain a slow, parasympathetic, controlled breath as you can. And this is what I do in the ice bath. I have one in my house, like right outside. It's amazing. But what I do when I get in is I remind myself with some positive affirmations that it's like, okay, this is for me. This sucks right now, true, but I know how I will feel in 5 minutes on the other side. I can do this. This morning, I did ice bath right before getting on here with you. And as part of my morning, I made coffee, intentional on making the coffee, no music, no cell phone. I knew what time everything was, like where I was time-wise. So I got into ice bath. And this morning in ice bath, I was sitting there, and then my mind started going like, oh, well, we have a call here in a little bit, like get out. And then my body started to get uncomfortable, and I was getting all squirmy and then cold in the ice. And I had to interrupt those thoughts and say, no, my body, like this is an opportunity for my body to be in charge. And in that shift, my body's like, okay, I got this. I'm good. And I just warmed up in the ice, calmed down. And I was like, all right, that was it. And then I got out. So journaling is amazing. It's proven. And as you're talking about journaling prompts, I was thinking about Michael Gervais. Do you know Michael Gervais, sports psychologist?
Yes, I'm familiar with, not in depth, definitely familiar with.
Yeah. Love Michael Gervais and his work. He's a sports psychologist for the Seattle Seahawks, and he's partnered with Coach Pete Carroll for their group called Compete to Create. And they have really good, like Compete to Create, kind of like Rehab to Performance, Compete, yes. The number 2, Create. They have really good basic how to feel better type, how to get grounded in your purpose. And that's what they do with their players in the NFL, is they take these individuals in and then highlight their individuality through journaling, through breathwork techniques, through meditation, mindfulness. So plenty of options. But again, I think I want to go back to that one point, is there is no right or wrong. Whatever fits you, fits you. Try as many things as you can until you find that one thing that you can't really get away from and it fits you.
No, I love that. I actually wrote that down while you were talking. I'm not gonna lie. When you say ice bath, I think of the time periods during my college career where I would get one of the white towels from the athletic training room, and I would curse into my towel during the first probably 30 to 45 seconds in the ice bath. Mm-hmm. But I will say that the ice bath was critical to my college midday nap, because after we did all of our stuff at Ohio State in the morning, I would pop in the ice bath, and then we would go to a place on campus. We would eat. My legs would still be just chilly, but it feels good. And then I would take a nap, and then I'd have my classes the rest of the day into the evening. But I'm not fully maybe appreciating what an ice bath was doing for me at that time in my life. So it's something, admittedly, I keep having on my list. I need to go to, it's a Wim Hof course, right? 2-day course or something, or?
Yep. Yeah. There's all kind of like Wim Hof courses. There's Wim Hof online. I'm sure there's a local Wim Hof certified instructor in your area. It's growing fairly rapidly. And then other people do kind of like offshoots of it, like XPT, Laird Hamilton.
Yep.
There's different programs that push breath work and ice bath. Brian McKenzie, I don't know if you're familiar with Brian McKenzie. He's power, speed, endurance. He's my personal mentor in this space, and he's freaking awesome. I love that guy. So there's a lot of opportunities and information out there. And I'm sure if you're interested in something in person, as a listener, just look up Wim Hof in my area or Wim Hof in your region.
Okay. I think like a lot of people, I'm probably sitting here and I'm going, all right, I can imagine when I can incorporate breath work. I can imagine when I can incorporate cold exposure.
Mm-hmm.
When we're talking about people,
Mm-hmm.
clients, patients,
Yeah.
and their entry point into physical therapy, when and how are you going to implement some of these things? Is there a decision-making process? Does some of it happen every session? Is it something maybe that you educate people on once, and it's something that somehow there's supportive material to allow them to kind of self-guide their on-ramp? What is that like? Because sometimes I sit here and I go, gosh, there's so many different things that people might need, but how do we then incorporate it easily into our main thing, which our main thing is physical therapy, right? In terms of a branding standpoint, people are coming to us for PT. So what recommendations do you have there?
Yeah. So I think there's a few things. Well, first, let me gather my thoughts here. It depends on the patient, obviously. Always, like, I love that question, physical therapy school question. Answers always, it depends, right?
Yeah.
For me, I've found a niche in the chronic pain space. I see a lot of individuals with chronic pain, chronic migraine, post-concussive syndrome, hip pain that just hasn't gone away. And as as such, I'm working with individuals who are having these heightened pain experiences, and them knowing what I do and how I work, there's usually an interest coming from the patient. I want to try that stuff that I see you doing that crazy stuff and breath work. I want to try that. So there's this interest for me. So for me, it's set up nicely. Now, I also work with people who don't know what I do, and they just sign up and they look for a physical therapist. They find me and they come in with musculoskeletal injuries. And typically what we'll do is the normal workup, assessment, and examination, and start to get into the exercise portion. And what I'll do is I'll take a little bit of a yoga perspective, is breath to movement. And as they're doing their exercises, I'll just, not without educating and going crazy on why, just say, okay, I want you to take a deep breath in on that lift, and then exhale as you like lower down. Or your next squat, I want you to exhale fast as you stand up. And so I'm thinking about how they can utilize their breath to optimize their movement. And in doing so, that's planting a seed. And then they'll maybe ask, okay, that's cool that I'm like, no one's ever told me to breathe and move at the same time, but I can see why that works, because there is this correlation on why it works. Now, as far as the cold exposure, all this stuff can be seen as woo-woo, right? But there's a lot of scientific research underneath it, and it all comes down to stress. So emotional health, right? Like talking to a guy who's rough, like, hey, are you dealing with some emotional stuff? Like, it's like, no, I don't have emotions. What are you talking about? Right? It's, hey, are you dealing with stress? Is there stress that's potentially impacting your pain? Yeah. Is there stress that's potentially impacting or can you imagine, like, do you have stress in your life? Yes. Can you imagine that stress can help, like, would prevent you from getting optimal recovery, right? The more you're thinking about that stressful stuff, the less your body has space and energy to heal properly. Yeah. Okay, cool. So are you interested in doing some kind of stress reduction breath practice shortly so that we can optimize that healing space for your injury. Yeah. So I use an interchange and like highlight that word stress, because one, it exists in all of our lives. And then two, it impacts us. But three, it's almost like a disguised word where you can use it interchangeably and people will respond positively. So
Yeah, I mean, I think, gosh, I've gotten much more comfortable, obviously, with describing what's going on with people with regards to just the word stress, either acute situations, chronic situations. I mean, at the end of the day, when even we have something that is like, a tendinopathy, or this has been going on, and overuse, there's a lack of accommodation to physical stress. I think a lot of people don't fully have an appreciation for the fact that things like sleep, nutrition, and physical activity all can contribute positively or negatively to stress. So, hearing you a little bit, I'm still trying to continue to find ways to implement things seamlessly at Rehab to Perform. We typically will use email drip campaigns that mirror, a diagnosis code. So we have some things that are specific to diagnosis code.
Yep.
And we have some things regardless that are going out to everybody, like sleep, a more anti-inflammatory nutritional regimen, just, exposing things to people. And in my head, I'm like, all right, well, our first place is going to be introducing breath work and introducing potentially cold exposure through email newsletter and social media. But I'm just trying to find a way, hopefully, to educate clinicians a little bit, to do a better job of specializing it, but not to go too far down a rabbit hole of where my head is thinking about implementation at Rehab to Perform. But I mean, what are your thoughts there?
Well, I love it because I love that's how your mind thinks and how it works. And you're like, there's something here. And I don't want to just impacting, like shoot this information out to the newsletter, but also my clinicians. I want my clinicians to live and experience this stuff and understand this stuff. And so there's a lot of intro work out there, and I understand the desire to have like a seamless introduction and like where it fits. So I can see your mind working and strategizing. And I think that there are ways, but for me, I'm an independent practitioner. I'm a sole proprietor. Like I'm on my own.
Right.
And so I get to guide and go wherever that takes me. And it fits within my company, because I am my company. For you, there is a little bit more navigation and strategy that comes with it, because implementing this stress will have to be bought in by the clinicians and taken in. And I know that, how many employees or physical therapists do you have?
We have 16 PTs.
16. So one of those 16 is going to be crazy enough to be like, I love this. And they're going to step into that role and want to do more and learn more. And again, use me as a research as much as possible, man. I'm on that R2P team for sure.
Now, I appreciate that. I mean, for us, like, just so you know what kind of conversations that I was having even this morning is, how do I put a vertical TV in the office? Say you're a clinician, breath work is something this person might benefit from. You want to introduce it to them, but you have only so much time during a given session. So then you send them to, say, a 2 foot by 3 foot TV, where they can either watch a video at the end of their session that is, a very, set way of communicating this information. And it at least brings them up to a certain level that they can have a more informed conversation in follow-up sessions. But it doesn't take away necessarily from the one-on-one time. And it's something that they can kind of reference, unpack, learn more about, because you provided them with resources. They can drop it, drag it, and email it to themselves as well. So that's just kind of where my head's, just because there's so many beneficial things, but your time is limited. So it's about supplementing with additional resources. And what I'll say is, you're just bringing the consumer up to be able to have a better conversation. Otherwise, and I think it's a little bit fatiguing sometimes, when we spend a lot of repeat time having, say, lower level conversations that are more of us talking at somebody as opposed to talking with. If I educate the consumer up to a higher level, I now can talk with them.
Yep.
But if I spend so much time talking on lower level stuff, I'm
Yep.
here, this person's here, and it's more of a lecture. So that's how my head, I walked into this, I'm like, I'm going to come out of this ideally with a better way of introducing these particular things to our community and potentially our clinicians. So
yeah, well, I hope I can help you with that. And as you're talking too, I'm thinking about, one, your tweet this morning about how you're shifting into this new space of
it's tough.
being the manager, right? And being the GM and working around and not being that clinician. Like, you're in a new role, new fit. And it sounds like you're taking that on beautifully. But you say it's tough. And so I'm curious on what's tough about it.
I think just the hardest part is like my initial goal when I got into PT was to be the best clinician I could.
Yeah.
I got to a certain point after starting Rehab to Perform where I just looked around and I was like, what am I good at? What do I enjoy? What fills me up? And to be quite honest, I have some amazing PTs around me. So I'm sitting here going, well, they're better than me at that. Well, they're better than me at that. Well, they're better than me at that. But the thing that I'm very, very good at is solutions. I'm always thinking in solutions. Like it's just how I've always thought. I'm going to find a way to make things easier. I'm going to find a way to make things more efficient. It's just how my brain works. Not everybody's brain works that way. Some people are very, clinically focused. They have a hard time coming up with certainty sometimes in these more business and clerical or administrative related situations. So I have to be of the mindset where it is my job to serve my people. And I don't know if you saw my follow-up with Jerry Durham, but I was like, I'm honestly the owner of a record label and I have amazing artists. Like, think about like Death Row Records or Interscope Records back in the day, where you have like, that I think was the big boom, where you had record labels and you had talented artists and you had collaboration and you had outside companies coming in and getting incorporated with the artists and the record label. And that's just where I see my role at this point. So it's conversations like this that ideally help me fill the bucket of my team, which then fills the bucket of our community. But not to get too far off on myself and Rehab to Perform, the thing for you that I also want to hear is that emotional health work, deep emotional health work, and chronic pain. Yes. Those are things that I know that you're regularly unpacking. People are coming to you to manage these particular thoughts, feelings, concerns. You're introducing potentially to some of them the relationship of all of these different things in a holistic fashion. Mm-hmm. What's that like? How did you get down that niche? And what are some things that people just generally should consider when working with people that have some personal, I hate to use the word baggage, but it's like they're carrying around a backpack on top of things that are limiting them physically as well.
Well, we carry around backpacks, all of us. We all carry around all kinds of stuff. I feel like the analogy I've thought and articulated in my mind before is like, it's like we're walking maybe through, like walking on the desert, and on our back, we have like 10 anchors that are just dug in the sand. And as you're walking forward, these anchors are pulling you down. And then you're like realizing, first, I'm moving slow. You look around and you're like, but I don't see any reason I'm moving slow. And then all of a sudden you look back and you see anchor, and you can, as soon as you recognize that, you can cut it and you start to move faster. And we just have all these things that are pulling us down that we can't see because we're looking forward and to right and left, and we don't see what's behind us. So that baggage, it's true. We all have it. And how is it affecting you? How is it slowing you down? And so how I got into this, I was in it's twofold. when upon moving to San Diego, I was immersed in the yoga community, not just doing yoga, but this one yoga center, particularly named Gather in Encinitas. They were having like every Tuesday night lecture from someone in the community talking about spirituality. Every Thursday night lecture on brain neuroplasticity from a local, local doctor in the area. So there were all these like nightly lectures. And so I was going to these frequently, and that was a great way for me to spend my time. I replaced my Friday night at the same bar over and over and going to the same group of friends drinking with the Friday night, like learning more. And I was like, this is great. I'm learning. Plus, I don't have a hangover on Saturday, and I can get up, I can surf, I can run, I can do all my flow without being slowed down by one of those anchors that's called hangover. But so one of these lectures was on what's called the triangle of conflict, and it's how we have a feeling or emotion. So it's an inverted triangle, upside down triangle. At the bottom is feeling, emotion, and then top right corner is anxiety or physiological discomfort in body, and then on the other top triangle corner is defense mechanisms. So I have anger. The anger rises and gives me discomfort in my body. I don't feel the anger. I don't want to feel that anxiety. So I go and drink. I go and excessively run for 2 hours. And I do these defense mechanisms that will essentially avoid this unconscious feeling. So there's a psychiatrist that was leading this lecture. And I was like, that's fascinating stuff. And she's works at a group called Bold, which is a substance abuse group, and it's for pretty intense inpatient substance abuse psychiatry. But as she was talking, she was speaking about substance abuse and these defense mechanisms that get people in trouble doing drugs, maybe sex addiction, and it puts people in bad spots. But as she was talking, I was thinking about pain. I was thinking about chronic pain. I was like, wait, this makes sense for chronic pain in my head. And so I started going. I was like, I would love to come and observe, because they had free groups and open groups where they have like essentially like an AA meeting, but under their own like triangle of conflict philosophy. It's called ISTDP, Intensive Short-Term Dynamic Psychotherapy. And so I started going to that weekly just to observe. And I was in the room with like 12 people, and I'd say like, my name's Justin. I don't do drugs, but I'm very interested in this work. And again, every time they talked, or anytime someone would talk about their substance abuse problem, I would, in my mind, I didn't do it, but naturally is like, that's pain. Like that's exactly how someone who has chronic pain is like showing up. And this chronic pain in my mind was another defense mechanism. And I'm like, why is that pain? Like, what's that pain covering up? And so I learned so many great tools from the psychiatrists and from that psychology field, and watched a lot of video of supervision. And essentially that's what really got me into this idea of emotions, because that bottom point, anger, sadness, joy, grief, pride, guilt, shame, love, those feelings in our body have a physiological response, because emotions are energy in body. And so we can let the emotions come out and express our emotions naturally, because that's what emotions do, is they come up and out naturally in some kind of expressive form, or they're pushed down, suppressed, repressed. And in that pushing down, repress, and this is unconscious, right? We can consciously do it, or it'll just naturally like be pushed down from any kind of behavior. When that happens, that's not an open release. It's kind of like a closing tension, and there's that backpack that you're putting on. I'm angry at someone and I'm tight in my pecs. My shoulder's always tight. All of a sudden there's some impingement here, and it just won't go away. I'm doing all the physical therapy in the world. I'm doing chiropractic. I don't know what's going on. I'm doing all the right exercises, but it still hurts. And that, at the same time as I was learning this, I was seeing patients, and I started recognizing that they were coming in with this invisible backpack, and their shoulder was hurting, their neck was hurting, their back was hurting. They were doing all the right exercises. And I'm a PT, fresh new grad. And I'm like, these exercises are supposed to work on you, and it works on everyone else. What's going on? And then I started to say, okay, let's breathe. Let's slow down. Are you tight? Like, is there some like stress? Okay, let's slow that down. And in slowing down their emotional body, relaxing their breath, their arm like started to relax and their pain would go down. And then and that was just my whole rabbit hole. And that's really what flipped me up. And so at the same time there, I started doing more of the emotional intelligence work. And yeah, the rest is history. So
it's a very, very interesting trajectory. I was not expecting an answer at all like that. So, I mean, right. I mean, you're almost putting yourself in like an AA class. Like, it's like, I mean, right. And learning about some of the psychological unpacking or shedding, right, of the weight in that backpack, and viewing, gosh, I hate to say it, it's not that people are addicted to pain, but they're almost addicted to the process of having, let's just use the word, say, chronic, right? So they're addicted to certain things that may be creating that outcome of chronicity.
Well, pain, like the feelings don't feel good, right? And pain is like a strategy. Our body always has a strategy to avoid that which isn't good. And then often like pain accompanies people for a long time, and it becomes a friend, and it's like the familiar individual, and there's a loneliness component. And so like it's not an addiction. It's just like it's a pattern. It's maybe similar. Some people will say that's the same stuff, but it's like this pattern. It's like this, your body's recognized that if I go down pain, that's safe for me. That's familiar for me. I get to okay, I can be there. So yeah, but continue, please.
No, I mean, it's just, it's fascinating. Your general trajectory and how you discovered that. And then, I mean, I don't know that a whole lot of people would have seen the parallels and immerse themselves in that situation that you did. But to be honest, just in the sake of time, and I feel like at some point we'll probably end up doing a part 2, but for people listening, I always want my guests to give them a little bit of recommendations, right? So just some recommendations, especially for the people going through PT school or some of the young professionals that haven't found what makes them tick yet, or aren't in as fulfilled of a situation as you are. What would you say to those people?
What pops in my head is community, especially in this time right now where everything's been shut down, and now it feels like maybe blossoming back up and out. Find groups, connect with people. Optimism, hopeful.
Yes.
Hopefully. But yeah, I'd say find a community in your area, right, that connects with something that you're interested in deeply. So here's the thought. Like, for me to get where I am, it's almost like I had to shed my old group of friends and go off and find new people, right? And the hardest part was like shedding my old group of friends. And they're still my friends. And like, we're even closer now. I just had to go away from that pattern that was holding me back, and they still love me and I still love them now. So it's like, don't be afraid to shift away and follow that fear of like, okay, that feels uncomfortable. So regardless, I would suggest seeing people that are doing things that you like and you would want to do, and you think, I wish I could do that, and go spend time with those people.
Yeah, I love it. I mean, whether or not it's mentorship or, I mean, you mentioned community. Sometimes I think of just immersing yourself into a community, much like you did. I will say that people should focus on the 3 C's, which is intellectual capital, which is sometimes the only way that I think that young professionals are trying to develop themselves, and they neglect that social capital piece on top of the financial side. But the social capital piece being stuff that gives us that sense of fulfillment. It lights us up, like being around people, or at least being around the right people, can help us find where we are, where our space in society is. So I greatly appreciate that.
Yeah, man. Thank you, man. No, definitely.
Yeah, I mean, for you, now that people want to potentially reach out to you, I know where you are on social, but for the listeners out there, where are the best places to stay connected with you and potentially reach out?
Yeah. So easiest is through Instagram and my website, True Self Health on Instagram, all one word. And my website is trueself.health. So www.trueself.health. I want to be an open point of resource. I just share what's on my mind. Whatever comes to mind, I want to just, again, put it out there. And if you have any questions, I'm answering questions all the time. So this is my part of my role. I've accepted it. I love it. I'm really embracing this, like, teaching from this interesting 2021 angle. But yeah, so True Self Health, or trueself.health. And again, please ask a question, reach out. Happy to support in any way.
Awesome, Justin. Thanks for your time today. I really appreciate it. We'll definitely stay in touch.
Thank you, man.